Why is it hard to urinate in public restrooms? Have you ever felt a sudden urge to go but found it almost impossible to do so in a public restroom? You're not alone. Many people experience difficulty urinating in public settings, and understanding why involves looking at how our bladder and nervous system work together. Urination is a complex process that involves the brain, spinal cord, and muscles in the pelvic area. When your bladder fills with urine, stretch receptors send signals to your brain that it's time to go. Your brain then sends signals back to relax the urinary sphincter, a muscle that keeps urine from flowing out, and to contract the bladder muscles to push urine out. This coordinated effort allows you to urinate smoothly. However, in some cases, psychological factors interfere with this process. A common reason is a condition called persists, or shy bladder syndrome. This is a form of social anxiety disorder where the fear of being watched or not having enough privacy causes the brain to send signals that prevent the sphincter from relaxing. As a result, the muscles stay tense, blocking urine flow. This anxiety can be so strong that even if your bladder is full, you might feel unable to urinate. Environmental factors also play a role. Public restrooms often lack privacy, with open stalls or noisy surroundings, which can heighten feelings of vulnerability. This environment can trigger anxiety, making it even harder to relax the pelvic muscles needed for urination. Additionally, some people develop pelvic floor muscle tension due to stress or past experiences, which can cause urinary hesitancy or retention. When these muscles are overly tense or not well coordinated, they can block the flow of urine. It's important to note that difficulty urinating in public is usually not caused by bladder disease or cancer. Conditions like urinary tract infections, nerve damage, or prostate enlargement can also cause hesitancy, but these are physical issues with different treatments. Persistent trouble urinating should be evaluated by a healthcare professional to rule out medical causes. From a bladder health perspective, ongoing urinary retention or incomplete emptying can increase the risk of urinary tract infections and even affect bladder muscles over time. But most often, difficulty urinating in public is a psychological and functional issue rather than a sign of serious disease. Managing this challenge often involves behavioral strategies. Techniques like cognitive behavioral therapy, gradual exposure, and relaxation exercises can help reduce anxiety and retrain your brain and muscles to relax when needed. Pelvic floor physical therapy can also improve muscle coordination and reduce tension. If the problem persists, a healthcare provider may recommend tests or exams to ensure there are no underlying medical issues. In summary, the main reason it is hard to urinate in public restrooms is due to anxiety that prevents the relaxation of the urinary sphincter and pelvic muscles. This condition, known as persists or shy bladder syndrome, involves both psychological and neurological factors. It's a common issue that can often be managed with appropriate therapies, but always consult a healthcare professional for personalized advice. Remember, understanding your body's signals and seeking support can make a big difference in overcoming this challenge.